Welcome to the channel The World of Ayurveda. In today's episode, I will like to share with you the current situation of the pandemic COVID 19. Friends, this pandemic, which perhaps originated in November 2019 in China from animal market and was declared as pandemic by WHO in January, has already been with us for now over 10 months. This pandemic has thrown best of the health facilities to irrelevancy, and the data that over 32 million people have been infected by this virus and over a million of people have died due to the complication of novel coronavirus itself speaks of the gravity of the situation. Ultimate hope of the management of this disease lies in availability of the vaccine, which will require mass vaccination to control the disease. As all of us know that there is no very authentic drug to actually treat the patient, and in best of the hospitals only patient symptoms are managed so that he becomes COVID 19 without landing into mortality or serious morbidity due to this particular disease. The aim is to maintain the oxygen level of the circulation to that adequate level and see that patient doesn't land into multi-organ failure. We all know that this disease spreads by droplets from one person to another, for which we advise social distancing in particular, wearing the mask in particular, and the droplets which may rest on a surface can be touched by us, brought into our contact, and it can get entry into our body when we touch our mouth, nose, or eyes. Evidence has also been given that this is a community airborne disease, and people have been found to be COVID infected in spite of no trace of their coming into contact with some infected patients. COVID 19 doesn't kill everybody. We all know this thing. Hardly 2% of the patient die due to this disease, due to serious complications of the disease. The data has shown that around 80% of the people do not show any, do not show much of the symptoms. Some of them may remain asymptomatic. Some of them may have only mild flu and recover. They get antibodies in their blood and recover out of it. Only 15% has moderate to severe symptoms, and most of these symptoms are flu like symptoms, severe body ache, fever, and 3 to 5% of the patient become critical. They need to be admitted primarily to avoid hypoxia, that is, low level of oxygen in the blood, and 2 to 3% is the worst mortality rate of the disease. This is usually due to hypoxia induced by the pneumonia, and sometimes the multi-organ failures. You ask best of the medical facility for any reliable treatment of the disease, they will only say that it is the patient's immunological system which has to fight the disease. Hospitals can only fight the symptoms. Naturally, when this type of pandemic is there, prevention takes importance. Now, prevention is aimed to stop entry of the virus into the body. And this is more important in the people who have got a lot of comorbidities. It has been observed that people suffering from chronic respiratory disorders, chronic smokers in particular, which leads to a very well known disease we call as COPD, people with heart disease, people with hypertension, people with diabetes in particular, especially uncontrolled diabetes, people with organ transplants, people with malnutrition, people with drugs which suppress the immunological system for the treatment of their chronic diseases are more likely to suffer this particular disease. Now, they need to be more cautious as far as prevention of the disease is concerned. Needless to say, most of these people are the old people, people with advanced age. It is well established that the mortality is more in above 60 years of the age, and almost 75% out of them have got comorbid diseases. But still, no age is immune to the morbidity and mortality of the disease. We normally have four-step prevention. Number one is wearing the mask so that even if you are infected, you do not spread the droplets far away. And at the same time, if you are not infected, your chances of getting the infection are also reduced. It is not an absolute precaution, but is a reliable barrier for getting the infection. Now, this mask should be standard mask, approved mask, and multi-layered cloth mask is the best. It should cover your nose, it should cover your mouth, and it should not leave any room so that when you breathe, the unfiltered air enters your lung. At the same time, the other precaution is using the sanitizers. The sanitizers primarily should contain more than 70% of alcohol. Anything below less is not very safe. The importance of moisturizers and flavors in them or scents in them is of no use. It is the alcoholic content which will kill the organism. Social distancing, maintaining a distance of 2 meters, is advised because the research has shown that if somebody is talking or coughing with his hands over his mouth or mask on, the virus is not likely to travel beyond 2 meters. Therefore, social distancing again becomes important. And lastly, frequent washing of the hands. It is believed that the caustics present in the soap has got capacity to kill all the viruses which we get on our hands by touching the infected surfaces. So this has to be followed by everybody, and this will give lot of guarantee that one who follows all these precautions carefully will not be infected by the virus. This data has been proved the world over. Of course, the best prevention of this disease is your own immunological system, and that is why 85% of the people, they do not develop serious symptom of the disease. Now, as far as drugs are concerned, a lot of drugs have been advocated for use. These may be drugs which help in killing the virus, help in stopping the division of the virus inside the cells, or promoting the immunity of the individuals. I will be talking about that in my next episode, especially what alternative system of Ayurveda has to offer in that. The very famous Ayurvedic kada or decoction made out of herbs in the market, propagated by Ayush, is available with reliable assurance of betterment of immunity of the individuals. Today's episode, I will stop here and hope that you will continue sending your feedback of these episodes on the email, especially for this channel, The Word of Ayurveda. The email ID is ayurvedahealthhelpline@gmail.com. Ayurveda Health Helpline at gmail.com. Thank you. Thank you, everybody.